Hello, good morning, good afternoon to everybody. I'm Diana Lopez, advisor for local governments and cities here in New York, UNDP, some logistic guidelines. We also have the option of doing interventions through the chat. We ask the participants to introduce themselves if they want to share information, ask questions to the panelists, or share resources, a web page. Please use the chat version for that. Also, we will record this webinar that then we will proceed to edit and post on our YouTube channel. As I was saying, I am Diana Lopez. I am based in New York. I work with local cities and governments in UNDP. And this series of local solutions from SDGs wants to gather practical solutions that local and national governments in the world are implementing to make the 2030 agenda a reality for everybody everywhere. We have held 20 or 30 of these webinars. And the truth is that we find that this is a very useful mechanism so that the cities can get in touch among them, share, and also dare to confront this somehow complicated situation worldwide. And we believe that city diplomacy and keeping communication channels among everyone is especially valuable at this point in time. Today, we have with us the city of Bogota through the Secretariat for Women from the mayor's office. UNDP has been working with them since 2022, supporting a small part of the huge effort that the city of Bogota has made in order to turn Bogota into a caring city. Caring city. Sometimes it is not very well translated because it is not only that the city takes care of people, but also the city is really it cares about people and makes public policies based on the fact that it cares about people. So the idea is to be close to the citizen and live where the policies are enforced. Today, we want to introduce the guide regarding how to become a caring city based on the experience of Bogota that has been implemented the system for a couple of years. And we always want to offer practical solutions, inspire other cities that are seeking to start a caring system and they don't know where to start. So we want to identify the challenges, the main satisfactions, how to communicate the citizen what has been done. That is very important. Sometimes we don't have time because the public stakeholders are running from one place to another, trying to enforce and responding to the needs of the citizens. And not very frequently we can sit down and reflect what we have learned. So this is the goal of today's session. For that, we have two panelists with us. First, we have Camila Gomez Guzman, who is the director of the district care system of the Secretary of Women in the Mayor's Office of Bogota. And also we have with us Claudia Mirta Luna. She's the supervisor of the Global Mayors Challenge in Bogota. Without further ado, we are very happy to have you with us today. And I give the floor to Camila so that she tells us about the experience of Bogota that has already become a worldwide reference regarding how we can turn our cities into caring cities. Thank you very much for the invitation and really have the chance to talk and socialize and share how we consider care vis-a-vis the current needs. Now, if we delve into Bogota with the time available, I want to present the proposal, the line of work in order to start working on care as a city bet. When we started to create the care system, we collected data regarding care and the problem of care in our city. What we saw, this is a picture of the situation at that time. So the idea was to identify that the care work because care is a work that is being done historically by women, but especially by women and in different women. So we have to understand that. We gather um, information from a national survey regarding the care work, who does the work and under which conditions. So we recognize that these are women the ones that do this work. So we identified the time allocated, more than 6 hours, the health conditions. Sometimes they have chronic diseases, most of women who do the care work. But apart from that, they don't have time for self-care, and that has an impact on them, on their life. And also they have left their formal job in order to do the care work, the unpaid care work in the family. So that leads to consequences for them, but for the family and the social context where we live, economic and social consequences regarding how we are experiencing this situation. So we have to talk about economic and time poverty for these women specifically. So considering this situation, considering the condition of women, we determined that as a city we had to respond to that situation. We have to respond and guarantee that there is a cultural transformation where not only that role is played by them, but by the society. And there is where the state intervenes. So how is it that we consider the solution? We wanted to territorialize the care service. We wanted to provide services to support women. And we have four modalities in the care system. So we thought about the care blocks. These are physical already existence facilities where we could bet on articulating, involving different entities in order to have an impact on this specific territory with an already existent infrastructure. So we didn't want to wait for the creation of specific infrastructure in terms of accessibility. We took the existing facilities and we betted on an intersectorial bet. But maybe there are certain people who, in those places, in those territories, cannot have access to the services. So that's why we have the mobile care units, because Bogota is very large and also it is quite complicated because we have a rural area that is very big, 70% and 40%, 30% is in the urban area where most of the people are located. So we have to reach other places where there's no infrastructure. So we use the mobile care units and we um, provided certain cycles. But also we had to reach the homes where due to mobility situations, certain people cannot leave their homes and these people are in charge of people with disability. And that is a big burden that women specifically have and the caregivers have. So we identified the need for providing services, not with infrastructure or care units, but rather to reach their homes. So we joined UNDP to work in the cities. And also something else, in certain places, we provided services, but we had no buses, no infrastructure. So we thought about other operational units where these care services were provided. So we territorialize the care services with specific interventions. At the beginning, I talk about data. We should have political and data consistency in order to respond to this and to move forward as a city. So Bogota made very important progress and obtained very good benefits. We thought about a regulation, an umbrella regulation, and this is a timeline that not only considers Bogota, but rather Colombia vis-a-vis care. And here I want to zoom on specific points. We talked about a public policy of women and gender equality, where one of the goal 11 responds to having a care system, because this is a historical debt we have to women. In order to respond to this debt and women in the differences and diversities, we should wonder who do the care work, who do the unpaid care work, and when they are paid, how they're doing, because they are poorly paid, and we have to think about where these women are. So we go back. This is a historical debt. So we provide with the services. We want to guarantee the rights of women in the territories. And with this cultural transformation intervention, so we had to think about a city intervention. And here we creating the territorial plan that not only includes the municipalities, but also public policies. We have to think into 30 years where we can talk about 45 care blocks. So all the infrastructure, all the mega projects that we think as a city should be covered in terms of care. So that things makes us think about infrastructure with accessibility and this city that we are considering for the future, where care always is included. And another thing that I should include is the feminist economy. When I talk about the data, I talk about the free time use survey and the care ethics. We should think about that. We should think about how we will transform the care conditions in society. And this has to do with the narrative, it has to do with the cultural intervention in terms of how we think about these aging cities. And there is an emergency to think about care among all of us. So here we are talking about services and policies, but not only that, a system that convenes a situation where we take care of care, but not only we will involve the district, but also the private sector, the civil society, the community-based organizations that from the very beginning are doing the care work in the field, and also all women, men, and the city as a whole, non-binary people, because we want to guarantee the rights of the people who are caregivers. We have three main goals. We have the 5 Rs that the ILO gives us and the feminist economy bets. And here we talk about three. We want to recognize the contribution of the caregivers, mainly women. We want to redistribute the responsibility in an equitable way between men and women and society. And we want to reduce the care work done by women at home. So here is with this outlook, we determined the target population, the women and caregivers, and also the people who require care. And also we have social policies that responded to them. We are talking about people under 14, people with disability, and elderly people who require care. And here we think how the services can respond to these needs of these two specific groups with special characteristics and criteria in the field. Here I'm going to move forward, and here we talk about the bets in each one of the modalities that I mentioned at the very beginning. So if we talk about the care blocks, this has to do with already existent infrastructure in a specific territory. But here we have special criteria. It's a double care. It is simultaneous and proximity. We are reaching the territory, we are providing services, but the services have a certain approach. And here we have to think about this. These are not social services per se, but care social services that lead us to a transformation. We want women to keep on doing this. We don't want them to live that situation, but we want to give minimum conditions to guarantee benefits for them. And also we want to see a transformation in the narrative so that the women recognize their own rights through the services that we provide in their care blocks. And they should be simultaneous so that when the people go to the care blocks, the people that they care should be covered by other simultaneous services. We want the autonomy of women and also the autonomy of the people that are taken care of. So there we can talk about the reduction of the care work for them, the enforcement of the rates and spaces. And remember the initial picture. All these services that we connect to the care service for women and caregivers and the people that are taken care of are thought in order to improve the situation that we described at the very beginning. So we think about specific components.
So thinking about these people is to think about the economic autonomy. We have to improve their work situation, but also we need to develop the skills or improve their skills so they can enter the labor market. But we also see that they have an overburden in their mental health, and this has consequences for them and for society. So we need to think about also respite spaces for improving their mental and physical well-being. And then we have all the caregiving services. Where I'm saying this because all the cities respond to social needs with services, social services, but not necessarily for caregiving. And this is what we have to think about, how we can make progress in providing care to all those caregivers, and which will be the approach for the services, which would be the goal of those services. And here we are seeing a specific block. We have the existing infrastructure with this central building, like an anchor equipment where all the services are provided, but there's also a physical space where there are certain interactions that have to be guaranteed. That's why we are talking a caregiving infrastructure to see what is going on in the physical space in the block. But we are also thinking about complementary equipment. It's not just one building or facilities. It's how we can coordinate the whole territory to provide those services in this new city. These would be the blocks. These blocks are existing infrastructure, so there are certain barriers to accessibility in order to provide the services, and little by little we are trying to overcome them. Then we have the mobile care units. These mobile care units are used where we don't have the infrastructure, and this picture really is not showing what a mobile unit is, in fact, but these are like mobile units that come to the territory. Then we have some tents that can be deployed and they can offer services for women caregivers. We have computers, Wi-Fi, healthcare services, legal assistance, psychology assistance, and we need to have the infrastructure for that, of course. And when we talk about these, we need to think about services with a specific goals and specific conditions and infrastructure. These we coordinate these from the Secretariat of Women. We don't just coordinate, but we also get in touch and work together with 22 agencies. So this is a joint proposal where the different sectors are connected with the different working teams, and we go to specific territories to provide attention and service. I would like to present you the new proposals. I was talking about 4 modalities, and we know that the city is growing and people and there are more people in the city. So there are barriers for people to get to these services. So we thought about the universities, compensation agencies. These are the PPPs, the public-private partnerships that we developed for this. This is the idea we have in Bogota to think about itinerant caregiving. And this is not just a specific infrastructure, but we think about territories where there may not be any infrastructure, but we can have certain PPPs in order to get access to new spaces. For example, the universities, students, women students have many times told us that they cannot access to the care blocks services because of their timing lines. So we try to get to them with the same criteria. We have also did a study of which are the entities that provide these services and the equipment they have, and now we have to think about territories. That's why I'm saying that all the time this had to be coordinated, but the idea is that women at universities would not have hindrances or barriers because of the people they are caring for, and how they can have access to these services through different means, maybe shopping malls, there may be areas where we have seen, for example, murders or women femicides in public spaces. So we have to think about who will provide this caregiving service in these public spaces. And what we have seen is that those in charge of cleaning or those in charge of service in the shopping malls are women, but they have like a 2 or 3 burden because they have their paid job. But when they get home, they also have to care for people at home, that they have 2 or 3 labor burden. So the idea is to provide a joint proposal for them for training, for education, so that they can finish secondary school, for example. But this is not just for them, but also we have to start working on their working conditions and many other issues. For example, some examples. We are talking about characterizing these caregiving people or caregiving women caregivers. So if you characterize them, you can think about specific working conditions, startings to flexibilize timetables, just to make it compatible with their burden or caregiving burden at home. So now we have a community care strategy, and we acknowledge that in society, when the state is not present and the families have to provide a response, the community or grassroots organizations have created networks to replace the absence of the state. And we are working with them, but we are just in the first stage. And the first thing we have to do is to do a characterization, our surveys and identification. We are getting to different areas of the city to identify which are these organizations and start a dialogue with them to see what they are doing and what they need. Sometimes they don't require support in providing caregiving services, but sometimes they require support in the fact, okay, we provide the care, we are caregivers, but who cares for us? Who cares for our mental health, our overburden, etc. So this is what we are doing here. It's the same as the 3 Rs. The idea is to identify which R's are our goals in the system. So we need to get to these spaces to recognize, redistribute, and reduce their time burden with services that we can provide to them on the territories. And now another important issue is can how we can get to these territories and implement these models. This is a technical process we have started, and we need to identify territories with certain priorities. Of course, the need for caregiving is all over the city. So how do we get, or who do we get first to? So we started with a prioritization system, taking account certain variables. These variables taking into account which are the needs for caregiving in the territories. And remember the question I made at the beginning, who are the caregivers and under what conditions they do it? So we tried to identify the location of ethnic groups in the city, because these women could not get to the mobile care units or the care blocks, because they are thinking about a community caregiving system. So we need to get to the territory and to try to use different modalities here, like itinerant caregiving. So we also had to think about which were the conditions of gender-based violence in these territories, because we need to guarantee rights to specific populations and specific sectors and women. So we had to identify where rights were most vulnerable, where there were gender-based violence, and those were the places we wanted to get first there. Also, we had to think into account the different variables as regards the territory to see how we can have an impact on these projects. But we have to go also to what are the barriers for access, and that's why we do infield trips and visits to see the territory and how is it displayed. That's why we need to have a governance system. Of course, caregiving is important, but we need to have a governance systems that would enable us to do measurements on how the city is changing. Progress and advances. I would like to mention these. We started with 4 operational models, but as I was saying before, we want to have 3 or 4 years to implement this. And these maps shows us which are the care blocks and to what places in Bogota we have been able to start implementing this system. So specifically with the care blocks, because we need to remember that this means that we have already existing infrastructure and use them from this system. So we will have 4 new blocks at the end of these administrations, the mobile care units, Also, we need to do all the hiring, all the tender biddings, and we are going to have two mobile care units because of what I said about the city environment and the rural environment. So we need to think about urban spaces and rural spaces, and also the prioritization index. Why? Because the city is growing. So how we can include new variables and how we can address the diversity of women in these situations. Also, we have InfoCare. We have an agreement to have a governance system and interinstitutional systems that give us the possibility to do a follow-up of all these systems, but we also need to measure them. We need to have a progress report of how this works. I know that we have 33 variables, a dictionary of 33 variables that shows us how entities and agencies are connected among themselves. So we need to include all the goals of all the agencies into the system in order to characterize this specific population and provide service to them. Then we have also the strengthening plan. The strengthening plan is very important because we are guaranteeing that all the women that participate in this caregiving system, understand why they are there and what their role is, but not to just continue with this role in the same way, but in order to involve the family, to redistribute the burden. And as family, we understand that in Latin America, most of the households are led by a woman. And so we need to think about not just the families, but also the communities, because community caregiving is also very important for us. And we also are thinking about personal assistance and all these inclusion narratives. How language for us build realities. We know that start working on narratives from this proposal of cultural transformation will put us into different roles. Women in the caregiving area are elderly women, but they have had to go through different violence, economic violence, housing violence, and these conditions not just affect them, but also the society and the economy, so that we have to start working with them to have a different project for their lives that can be started through the services that we try to provide in the different territories. So with these, I can say that I'm getting to the end of my presentation. Sorry that it was very quick, but I wanted to provide you with all the information. But of course, this system in Bogota is still fighting for the right of the caregiving women and providing services to them.
Thank you very much, Camila. I like that you use the word progress because it's never ending, but this is connected with the number one goal of the 2030 agenda, which is not leaving anybody behind. This seems to be far-fetched. And from the perspective of a mayor, how is it that you go about to avoid leaving anybody behind? But you talk about specific actions in order to avoid leaving people behind, and starting by women that have an impact on the population. My first question is about the narrative and the change in the mindset, because concrete actions are very important and are the ones that are experienced by the citizens, are the important ones. But at the same time, I believe that your project impacts the narrative regarding feminist policies or policies for women that ultimately, by addressing the women that make up 50% of the population, they go beyond, because you are creating a territorial policy based on the strategic plan, or uh, this the social economic one is in Spain and the territorial one is the one of land use, but you use the territorial planning based on the territory and the makeup of the city. Because when you think about cities in Bogota, you think about the urban area, but you have the rural area in the mountains, in the hills, where people have difficulties to have access to the public policies. So there I see my first question regarding how this narrative in terms of working with women can really reach uh, population groups that are left behind, and how this has a decisive influence on how we change the way we interact with citizens beyond policies for women. It's a very metaphysical uh, question. And then we have three or four more concrete from the chat. Yes, the cultural transformation is a challenge. It's a big challenge, but without that progress, we cannot guarantee the goals of the R's. What is it that we see in the dialogue with women? And this is one of the progress that we set forth. When we started to talk with women in terms of how to belong to the system, how to be part of the system, how to use services, we realized that they did not understand why they were participating in these spaces or what should change in their lives as from their participation. So we were just providing services. When we started to talk about the care approach, there are 8 approaches technically led by the different institutions. So this is just not an intervention on the Secretariat for Women, but rather it's the intervention of the city as a whole. So we have to recognize the needs of every populational group, and the idea is to create a system because we involve all the population. With the policies, we have a target group, as it happens with the elderly, the childhood. But here we include everybody. So when we talk about approaches, we should see how the services we provide respond to the needs, but also from the narrative. We've seen services such as, for example, legal advice, training, these are services that tell women, that accompany women in this exercise, but also they lead to reflection and transformation. So how do we relieve the burden, but also what is it that we saw at the very beginning, the overburden and the mental impact on women. So we have to work with them on this, and also training. Every time they join the system, they should attend a specific training session. Both the people working in the system, the 22 entities, should be qualified. We should all have a clear discourse in terms of why the system exists, the direction of the system, where we go, and at the same time, women, the people that are participating, should be trained. And we created a specific course, which is Women Who Care, Women Who Have an Incidence on the World. So we teach how care is a job, how the society responds, how we have rights, and we should enforce them from the services we provide. So this transformation intervention has to do with a discourse and a narrative that we should interiorize, not only the citizens, but also the service providers, and a joint line that we should think as a city. Yes, the narrative is fundamental, especially in a context as a city where you have direct access to people. I believe that the impact that can be made by the city in the people living there is direct. And we are seeing this with the climate policies, starting by recycling, but going to other topics, such as, for example, the change we should make in terms of consuming. So this is something that the central government we shouldn't do, not us as UN. So that transformation is fundamental, and that part of the narrative should not be forgotten. And cities, when they make decision to become a caring city, should understand that this is not a policy to help women. Is starting by women that continues to be 50% of the population. The idea is to transform the way in which the mayor's office provides services. But I believe that the part that you have chosen is fundamental because you provide concrete solutions. And within the concrete solutions, I go to the questions that we have on the chat. The first one is about How is it that you have implemented this plan in the rural areas, and how you adapt the implementation in the rural area? So here we should consider the spatial dimensions through the care blocks that don't move, but also I like the idea of the mobile care units, which is the care mobility. We have physical places in the city where people can go, but also care moves. I like the picture of the bus that becomes a tent, because this is very good. It's not just a bus, it's not a mobile care unit, it's a space that moves, it's care that moves. So how is it that you have confronted the challenges in the rural areas? Okay, Bogota, well, 70% is rural. Sumapaz, for example, has been framed in a situation of armed conflict, strong ones. And from there, also, we should think about the right to peace of women. But not only it's Sumapaz, the different locations where we are. How is it that we have reached these territories? Of course, through dialogue. It's dialogue. It's being able to talk with the institutions that are present in the local areas. We have local mayor cities that allow us to go there and work from the data we already have and the needs already identified. Because we should also mention that it's the movement of women, it's the economy. These are interventions already started and we articulate them. The system allows for that with the aims to coordinate narratives, interventions and services. When we go to the rural area, we identified the needs, but also the idea is to be flexible, to adapt from the different entities that were already present there. So the idea to go there and do articulation, coordination, and create joint work to make public spending more efficient for the target populations. And we have to become flexible in the timing, also in terms of the arrival of the equipment there. The difficult thing in terms of the rural area is how to access there. There's no infrastructure, but also it's difficult to reach those areas. So we can do that through the dialogue with the organizations that are already present there. With them, we talk, we flexibilize the schedules because the rural area makes quite challenging everything for women. And we are not talking only about the accessibility and talking, but also climate change, water, cooking, because they cook with logs, the work that they have to do, because it's not only care, they have to do some other care work that we also considered. So from the national government, they thought about how we care for the environment, the care for the animals because we depend on them. So this has a timing dynamics. So the services will not reach the way we reach the cities, and we do the work based on the demand. So for them, the services will be provided not so early because they have to do specific work, but we use certain schedules that allow us to consider the work that they have to do. So we have to think about the territory, the timing, their own needs, and how we articulate as a city this joint intervention. How we do it? Well, in a duplicity, we want to have the space. And here we talk about small schools. We take the already existing spaces. So first we have to reach the territory, to get to know it, to talk with the organization. Later on, to articulate the 22 district entities to reach the specific points that we identified. Okay. I like this thing about the fact that the rural timings are not the same that we consider for the urban area. The second question is which evidence that you have here we are talking about the importance of data and the importance of explaining data to citizens, which is the pending task that we have somehow in terms of public policies. So the question is, which evidence do you have regarding a more equitable redistribution of work between men and women? Do you see this impact in the redistribution? What is it that we see when we talk about men and women? This is a challenge because we are going through a cultural transformation. And we have to involve the different entities. Of course, we work with men, but the system reaches very few men. Not very men reach to the system in order to talk about this. Remember that when we talk about itinerant care, the idea is to reach places where are more masculine because men are there. In those places, we go and we talk about care, how it is understood, who does the care work, because somehow there is a romantic view of care. So we should understand that care work is a job, and we have a debt there. There we start a reflection. So we read masculine spaces to consider these dialogues. But when we talk about specific figures, there we have a debt. We are creating some labs where the families can think about the redistribution of work, the roles of each person. And here we have coordinated with different countries also, where they have created technological tools in order to measure the care timing in each one of the roles in the households. But here we have bigger challenges because we're talking about families where the woman is the breadwinner. So we have to think about redistribution, and also we have to think about the rules in the participation of care at work. And we do that through the services that we provide and the dialogue spaces with the citizens. A very important one has been the psychosocial care or orientation, because there is where we can reflect with the individuals. There is where they can leave their burdens and take new initiatives. But another thing that we achieve in terms of measurements is to see how these services reduce burdens and time and care time in women. We've been able to measure that. We have these labs, we have the community uh, washers, for example, those the community washing machines, they can use those washing machines, so they stop washing the clothes and they can do other work. And also the legal guidance that we provide. We really use our time in order to create medical appointments and advise them from the legal point of view. We have lawyers, and we are measuring that, the progress made. The idea is to review in each one of the services, in each one of the interventions that we reach the territory, how is it that we can measure the progress made in the population. Thank you very much, Camila. We could stay another half an hour, but I'm going to give the floor to Claudia. If not, we will be short in time. So she will explain to us very specifically the part of the project that we have done with the Global Mayors Challenge. Claudia, you have the floor.
Good morning. I want to make a presentation on the guideline how to turn into a care city based on what has been developed in the city of Bogota. Camila already talked about the lack of time, and based on this, how the city of Bogota started thinking on how to establish a system as from 2020 with two systems, the mobile care units and the care blocks. But at that time, they identified that was a 14% of caregivers that have no access to these two systems. That's why an additional effort was made, and we presented this initiative of door-to-door care to offer services to those that cannot access the other two systems. And this turned into a different modality. So what was the concrete intervention was to establish an in-home relief service to relieve the caregiver woman of their task and help also elderly people and other people that requires care. And so at the time, the caregivers can also receive certain services and do other activities. There are 4 services taking into account that we are getting into the household. So the services we can offer are home care, in-home relief service, a professional gets to the household, trying to provide autonomy and independence to people requiring care so that the care time reduces. It's a session per week in 3 months. And in that time, we were really able to reduce the care time, and caregivers can have time for other activities. Then a knowledge certification. This is for caregivers, and the goal is to recognize, acknowledge, and validate the empirical knowledge of the caregivers as to do what they have been doing throughout their life. And this is through an agreement we can certify their competencies and knowledge so that in the future this could be useful to enter the labor market. Then the legal assistance service is focused on reduction is for the caregivers, because caregivers waste a lot of time going to appointments, requesting wheelchairs, diapers, and many other things. So these help them, to get to all these services easier, more easily and faster. Then the cultural transformation service that is focused on the R from redistribution, and is focused on the whole family, trying to have a more equitable distribution of the caregiving burdens within the households. So, here we have a map of the city of Bogota. There was 4 cycles, first in 2023 and the other 3 in 2024. And this was a progressive implementation, trying to get to all the sectors much more organized. This has a double entry program. On the first place, the caregivers should devote 6 or more hours a day to caregiving tasks. Elderly people over 60 or people with disabilities over 18 that have certain barriers and require in-home relief. So at the beginning, we did a identification and characterization of all the households, and this program was focused on people that have a total dependence, moderate dependence, or slight dependence with supervision, so that we can help them to get more independence so that they don't require permanent support. We were not getting to them with nurses or doctors, but with people specialized in helping them to get more independence. And this, you can see here the implementation stages. First, to have the data, then have the information of the caregivers, are those who require the cares, where are they located, the type of disability, the type of dependence, also to identify the institutional offer in the territory, which are the needs they have in the household, see how we can coordinate the services with the needs to have a follow-up and measurement system in order to identify issues and do adjustments at the time, also to elaborate procedures that would help us start making a roadmap. Focus on the population per areas, and implement gradually and in an organized fashion, also characterize the population and the territories in order to provide services that are adjusted to their needs. Also implement different services, strategic communication, trying to learn how people enter and how people leave these situations, and to see whether the goals were accomplished. Also provide information about the program, the progress, to provide information to the citizenship so that they know what is going on with the program that has been implemented. And finally, also to have a preparation phase to enter and leave the system. So we need to provide information to the population so that they know that this system, that this program is existing, and how they can have access to it, which have been the result of the program. The first service is specialized caregiving for people with disabilities. We have provided service to 360 caregivers, 398 people with disabilities or elderly people that required assistance. So there was a very low dropout percentage. Some caregivers have 1, 2, or 3, or 4 people that they have to care for. So that's why you have a lower number of caregivers compared to the people that require the care. As regards legal assistance, we provide service to 351 caregivers and 1,617 legal assistance. You cannot think about all the problems that you can find and the issues inside the households. Then knowledge certification, 333 caregivers had a certification of their knowledge. That was 91%. And as regards cultural transformation, we had 323 households where we had an intervention. So we have different studies to evaluate the results, and these are the results we got as to the reduction in the caregiving burden. There was a reduction of 1.23 hours in the caregiving work, 50% experience a lower burden, 90% of caregivers had a certification of their knowledge. 72% of caregivers have said that this program have improved their self-care and has reducing almost 20% the impact of the caregiving work in their social life. And what about people requiring care? For the 9.8% of people with disabilities increase their independence, and this has an automatic reduction in the caregiving time. More than 53% of the people that requires caregiving had an increase in their independence, and the percentage of families that acknowledge that caregiving has to be shared increased also. And of course, this has to do with the 3 R's that we discussed before, and which were the challenges we found out during the implementation. First, how difficult it was to provide caregiving and in-home release, to get to the households, required coordination in order not to saturate all the household, coordination of all the players, of all the actors, as Camila said, because there were many institutions and services. So we need to have a effective coordination, efficient coordination to cover all the needs. Resources are scarce or limited, of course, so we have to rationalize those resources in order to approach all the problems we had identified, different inequalities in the territory space. There are urban areas, rural areas, difficult of access, insecurity, lack of internet. So we have to have this information beforehand in order to provide the services. Cultural changes are slow. You cannot do anything in the short term. So we need to continue with our job in order to achieve those transformations in the long run. And then also informal jobs. Some people are caregivers, but they are not paid, or they are poorly paid. And certification of knowledge, of course, to provide elements to the caregivers so that they can enter the labor market in the short or long run, and also to have information and monitoring. This is essential in order to provide adjustments if the results are not the one that we are expected. And then we need to segment the population to define the type of care, the level of dependence, awareness raising workshop, also to certify the empirical knowledge of caregivers to provide them with more opportunities to enter the labor market, coordination between the institutions to prevent the overburden of the services, not to saturate households of caregivers, promote coordination between the different agencies to get there timely service. Also, international alliance, for example, with the UNDP or Bloomberg, which would be the recommendations. First, a previous or survey of all the services and infrastructure beforehand to have information of the caregivers and the people that requires cares, which are the capacities, the needs, to have all this information at hands. To also, the second would be to have data on the caregivers and the people, to establish governance mechanisms among all the actors and players involved, to have a follow-up system with evaluation, real-time evaluation systems, to define the clear criteria, and then to implement the program. And as a conclusion, we can say that the implementation of the program in the Bogota city starts from the recognition of the caregiving job, and to be able to provide services to those requiring care and the caregivers. So to improve the quality of life of the caregivers, the women caregivers, to increase their free time, available time for entertainment, for education, etc., and raise awareness of the co-responsibility of caregiving in the community, while the people requiring care are guided to be more independent. The program tries to drive for a cultural change and also have a more equitable distribution of the caregiving job, involving different people of the households. Sometimes we know that these are single parents households, so that we need to redistribute the caregiving between the person requiring the care and the caregiver. And all these also contributes to position the city of Bogota as a reference city in the creation of more equitable, fair, and more inclusive cities. Thank you very much. Thank you, Claudia. I think that is very important to give more visibility to all the data that you have gathered through this in-home relief program, and how we are working with the city of Bogota to try to provide better visibility to those data. We have started a process of trying to get those data to the citizens, because now communications are different, are more visual, faster, people understand more a graph or that data, pure data. So we are trying to devise like a visual way of providing those data. We have 3 questions, and I have a last question for Camila, and we have 2 works for Claudia. First is, what unexpected lessons you learn when trying to implement this in-home relief program? You have thought about an impact, but did you have any other impact you have not thought about, and was a result of this program? That would be the first question. And the second is, did you use digital tools for real-time monitoring? And then I have a last question for Camila, and we will finish the webinar. Digital tools, yes, we use forums, we used, or the professional got to the household with computers to collect information, and we recorded this information every day to have a monitoring of the results, and to see whether we had a real contribution or not to solve the situation. And the other questions, can you remind me? Unexpected lessons. At the beginning, we had not thought about working or mental health. But just we have thought about working with people requiring care, but luckily professionals that went to the households had a psychological background, so they were able also to do containment exercises and to do kind of workshops within the households to improve the relationship between the caregivers and the people requiring care. And they just were able to have more harmonious relationship among them, so that the people required care could acknowledge the importance of the task and the activities of the caregivers. And many of them were elderly women, wives, mothers. And so an unexpected result is that we were able to start working on support networks among the caregivers. So we trying to look for cost effectiveness, because it's a very expensive service, trying to provide service to the care block and the in-home relief. We tried to work on the mental health issue with caregivers, to establish dialogue spaces, to know, meet other people, other women, knowing that I'm not the only one, that I'm overburdened, I have an overburden, I'm not providing care, the issue of respite, entertainment, or to be able to have physical activity, dancing lessons, to these gave in order to give them different perspectives.
Thank you very much, Claudia. And the last question for Camila. Actually, there are two connected to this topic that we mentioned. When the mayor's office intervene, it never ends because here we see unidentified needs. And when we identify the needs, they are never ending. So the last question about the sustainability of the initiative. The first question is, what specific strategies are you considering in order to guarantee the permanence of the system beyond the administrations, how we shield the progress before the political changes. And the last one, how is it that you are working on the financial sustainability of the program in order to guarantee the permanence in time? Is there any strategy to integrate the system to the budget of the municipality? Uh, well, there are certain things that we have made progress already, and we have to make progress in terms of governance. That's why I was talking about the governance as the pillar that allows to create articulation at different levels. The first, the political level. There should be a bet, and this comes with the development plans. Then also coordination with each one of the entities because they should have a budget and they should allocate the budget. So there should be a bet on the city that should make us think about the pre-feasibility. At the very beginning, we should think about the projection of certain resources, the financial resources, the technical teams that will go to the field to serve at a certain schedule. So yes, we think from governance. So there is an agreement that covers all the entities. It's a zero cost agreement. So every entity, every team, every equipment creates the infrastructure, and the coordination of the system should not carry a cost or a payment, but this articulation allow us to have an operation inside, not charging, but the cost of every entity is to put the equipment, the team available and to create a strategy, an investment project in order to respond to the needs. One of the entities have a certain services that respond to certain population. This allows us to do a follow-up in terms of which sectors we connect, and also the partnerships with private entities also allow us to open up the outreach. We have more spaces in order to provide services, and also we can provide more services and more possibilities of actions with women and people who are caregivers. When you talked about governance beyond the plans, the government plans, precisely. That's why I mentioned that we should be connected to a public policy. And this allows us to do the follow up, to have allocated resources for that. And in turn, the idea is to be part of the land use planning. And this allows us to project. Bogota was thought from the land use planning. We use that in order to project the facilities, the I cannot remember the name, the social services, the care services, the infrastructure, all the infrastructure that we have for these two lines. And with this, what we should do, the different entities and sectors, is to respond to those conditions that should need the infrastructure for the provision of services. So the idea is then to see how every one of the entities responds. This is the bet that we are doing from Bogota, and this allows us to make progress beyond a municipality so that we can guarantee the projection of the care system for the future as a city. Thank you very much, Claudia. We are short of time. We have to conclude, although I would spend another hour with you. Some ideas somehow connected regarding what we have discussed today. For me, it's a source of pride as an official from UNDP to make our small contribution within a system that, of course, is much bigger, but we consider that that part of this in-home relief service is supplements a lot because it means not leaving anybody behind. It's going at the end of the ladder, is reaching those sectors of the population that maybe had never received a municipal service. And this changes the way in which the citizen receives the public service and the support of the municipality. And that is the fundamental part. When you reach certain sectors, when you have this unexpected learning, when Claudia was saying that these women are make up and um, before leaving home, right? They gain self esteem. People who had never had anybody helping them. So now I remember when I take a plane that you are told if there is an emergency, first you have to wear the mask before helping the person you have next to you. Because if you don't have no oxygen and you faint, you cannot help the rest of the people, especially people who travel with children or lack mobility. So this project allow many women to wear the mask so that they can help themselves. And that is difficult to reflect in a guide, in a UNDP document, in an official document. So what you have done in Bogota is extraordinary, and we thank for the effort done on a daily basis because it's not 1 hour to tell the story. This means lots of small interventions, great organization, lots of organization. The team has really created excellent procedure manuals regarding how to reach people's lives specifically with questions, indicators, manuals that other cities who want to learn the experience of Bogota can find. They are available. And it's very important to tell the story. And from UNDP, every time you want to tell the story, every time we can help you disseminate what you have done in Bogota, of course, we are at your disposal and truly a word of gratitude, sincere gratitude, because it is one of the most beautiful projects that I had to support from UNDP. So without further ado, let's keep on wearing masks in order to extend our contribution and our grain of salt, grain of sand to the people next to us. Thank you very much to you, both of you.